So if you're preparing for the MSRA clinical paper, have a look at this example question. Great, well done everyone. So let's launch the poll. First one, here we go. So as a reminder, this is a 70-year-old patient in a nursing home. And if you look at their symptoms that they've got, you might be thinking about a UTI, right? Dysuria, nocturia, urinary frequency, but without feeling thirsty and no blood. So, we might be thinking about a UTI. This is the key word here. The most appropriate diagnostic test for this patient. Okay. Sometimes it's really easy to miss one simple keyword and it can change the answer. So the split here, about a third of you, just under a third, picked A, urine dipstick, and over 2/3 picked B, urine culture and sensitivity. Okay, so the correct answer is B, urine culture and sensitivity. Why is urine dipstick not the right answer? Because in a patient who's 65 plus, you can't use urine dipstick as a diagnostic tool. Okay, and so it's not accurate enough. Whereas if you had a younger patient, someone in their 20s, very typical history, you suspect an uncomplicated UTI, a urine dipstick, if nitrites are there and they've got leukocytes, that will be enough for you to diagnose. You don't need to send a culture. For this patient, you need to send a culture. And a dipstick's a screening tool predominantly. But as I said, in an uncomplicated with very typical features, you can use it to make a diagnosis without bothering to send a culture. But in this group, the guidelines recommend that you always send a culture and that a dipstick is not reliable for you to make a diagnosis. Okay, do you see the key word here being diagnostic test? That's why the correct answer is B. So women under 65, no risk factors for complicated UTI, i.e. they've not got a catheter, they've not got a history of recurrent UTI, things like that. Typical history, do a urine dipstick, and if nitrites are there, about 90% are going to have a UTI. That'll be enough for you to decide, okay, I'll just empirically start antibiotics. But women 65 plus, women with a catheter, with additional risk factors for complicated UTI, any one of those or more, dipstick's not reliable. You need a culture. Okay. So pregnant women, send a culture. Persistent or recurrent UTI, not resolving with treatment, 65 plus female, send a culture. Okay. Second one in the set. So this patient had multiple UTIs over a year. The key thing here is, number one, their age, 4. Number 2, that the last episode was 4 months ago, and they don't have one at the moment, it seems, because they're well in themselves. Okay. Now, this is a good example. The clinical paper is, I would say, 90% knowledge, 10% technique. Whereas the SJT is the other way. It's like 90% technique and 10% knowledge, right? A big part of doing well in the clinical paper is covering the topics, doing enough questions, reading enough guidelines that you learn the material, you learn the subject, which is broad, so it takes time, right? But there is technique, reading and picking up on keywords, managing your time, things like that, okay? So correct answer is E, DMSA scan. And just over half of you got that right. A lot of you had picked abdominal ultrasound. That was the second most popular answer. And then quite a few of you had picked KUB X-ray. Okay. Again, what does most appropriate mean as a keyword? Appropriate for this patient. They're only 4 years old. In this situation, multiple UTIs, but well now, last episode 4 months ago. So if we look at what the guideline says about that, DMSA, by the way, stands for dimercaptosuccinic acid. No one can remember that. That's why we just called it DMSA. So children 3+, you see why that age is important. Okay, they've got an atypical UTI, they'd have an ultrasound during the acute infection. And then if they've got a recurrent UTI, they'll generally have an ultrasound within 6 weeks of the episode finishing, and then a DMSA scan to look for long-term features, like is there scarring and things like that, and what's going on 4 to 6 months after the acute infection. So if you go back, you can see 4 months ago, if they needed an ultrasound, that would have been ordered beforehand because you have that within 6 weeks. And so they would have already had that. Peds would have arranged that. At this point, they need a DMSA scan, right? So that's why that's the correct answer. So if you found that helpful, this clip was taken from our MSRA Masterclass webinar. You can watch the 75+ minute recording to cover lots of questions and boost your preparation. I'll pop the link down below.